Hello, in this video I'm going to give examples of 20 abbreviations which are commonly used within an accident and emergency department. I will also give a brief definition or example of how the abbreviation might be used. Hopefully this video will be helpful if you have got a new job in an A&E department or are a student with an upcoming placement within A&E. Please remember to always seek advice if you aren't sure of something within clinical practice and check the policies on abbreviations within the area you will be working. And now we can get straight into the video. So the first abbreviation we see is actually a symbol, which is a hash, which means fracture. It's commonly written like this: fracture of the ankle or fracture of the wrist. BP, which means blood pressure. So it might be written like this: BP 120/80, which would be generally a good blood pressure. MSU stands for midstream urine sample. We could see it written like this: MSU required, so we would have to ask our patient for a urine sample. CXR, chest x-ray. If a patient is suspected to have a chest infection, for example, we might write request CXR, request chest x-ray. DNR, do not resuscitate, so do not attempt to restart the heart if the heartbeat stopped or a patient stopped breathing. DVT, deep vein thrombosis. This is when blood clots form deep within veins, which can obviously be a medical emergency. DX, diagnosis. Could be written like this: diagnosis of diabetes or another medical condition that the patient is already diagnosed with. ECG, electrocardiogram. So this is checking the rhythm and the activity of the heart, which is commonly performed in A&E and other parts of the hospital as well. FBD stands for full blood count, which is a very common type of blood test. Again, it's used a lot in A&E and other parts of the hospital as well. IVI, intravenous infusion, which is injection of fluids or medication straight into the bloodstream. IX stands for investigation, so patient is under investigation or assessment for cancer or any other medical diagnosis. NAD, nothing abnormal discovered. Bloods, NAD, nothing abnormal discovered within the bloods. POP, Plaster of Paris, which is used for treating fractures. So basically the cast that is put on a patient, for example, if they've broke a wrist, this is made from plaster of Paris. PU stands for passed urine. So you might see it written something like this: unable to PU, which would need to be investigated further. RTA, commonly used in accident and emergency because it stands for road traffic accident. So this patient's arrived at A&E because they've been involved in an RTA. STAT means immediately. So using an example that we used previously in the presentation, you might see it written something like this: ECG stat. So this patient needs an electrocardiogram immediately without delay. TTA, usually in reference to a medication to take away. So the patient might be discharged from A&E, but they need to take some penicillin away because they have a throat infection. So it could just be written penicillin TTA. UCC stands for Urgent Care Centre. Could be written something like this: the patient's being transferred from the urgent care centre today due to a head injury. EAU, which is the Emergency Assessment Unit. So the patient needs to be admitted to EAU for observations. So they don't want to be discharged, they're being admitted into hospital, and EAU is usually the first place that a patient is admitted to. PC is presenting complaint. So for example, it could be written: today the patient's presenting complaint is a migraine. So thank you very much for listening. Please give this video a like if you've found it useful. Please comment if you want us to go into any more information about any of the abbreviations that I've spoke about today, or if there's anything else, any other abbreviations that you would like to hear about or learn about. And please subscribe for more